Namaste. I am Dr. Rachna Kucheria, founder DocGenie Telemedicine and family physician. I'm talking about obesity today. Obesity is recognized as a disease of body weight regulation or dysregulation. Just like you may know that diabetes is a disease of blood sugar misregulation. It is a result of long-term positive energy balance, which means more energy intake or calorie intake than energy expenditure or calorie output. Well, the reasons for obesity are multifold as we know them currently. The first being genetics. If one parent is obese, the person's chance of getting obesity is about 3 to 4 times. And if both parents are obese, this increases to 10 times. Pregnancy. Women, when they are pregnant, generally gain weight. And after pregnancy, they do lose most of it, but some tends to stay on. And with multiple pregnancies, this becomes additive. Menopause. When periods stop happening in a woman's life, the hormone changes at that time contribute or lead to increase in weight. Also a redistribution of her already existing fat so that it gathers more around her tummy, her abdominal area, also called visceral fat. Lifestyle. So our current food environment, I'll call it environment because it's everywhere. It's everywhere, it's easy to order, it's on an app, is highly calorie dense food and which is highly palatable, which is in simple words, very yummy. So this definitely is contributing to increased obesity. Ultra processed foods that come in cans or bottles or jars or packets contribute to obesity versus non-processed foods, things your grandmother made, which comes straight from the earth with a little amount of processing in your kitchen or cooking and on the table. Exercise and inactivity. So both things. You need exercise to increase your energy expenditure or your calorie output, but you also need to be non-sedentary. It's been found in many studies that the increasing sedentary lifestyle, increasingly workspaces have become sedentary over the past few decades. And one of the biggest things that leads to obesity is watching long hours of television. So both exercise and non-sedentary behavior contribute to the lack of obesity or the gain of it if it's not done. Sleep. Reduce amounts of sleep, late nighttime sleeping, night shift work, all of these can contribute to obesity. Medications. There are certain medications that increase weight, and there could be many different kinds. To name a few categories, there could be psychiatric drugs, some anti-diabetes medicines as well, some blood pressure medicines, anti-allergic medicines. So if one is specifically on a weight loss program, your doctor would try and cut back or swap medicines for those that are not obesogenic. Gut microbiome. What is that? Basically, it's the bacteria that are in your gut, in your GI system, in your intestinal system. More and more research is showing us that the ratio of certain bacteria, the Bacteroides and Fumicates, contributes to obesity, and having a healthy gut microbiome helps people stay lean. And some of the things that help your gut microbiome are fresh fruits and vegetables, raw, unprocessed, with the peels. So these are a few reasons why people gain weight, and we will talk in subsequent sessions about how to manage these. Or you can consult your doctor if you're having trouble losing weight or you're continuously gaining weight.